If we want a community to be healthy, we cannot think that health will come from building another hospital or adding more clinics to the area, because most of people's lives are not spent in those spaces. They're spent getting food for their families, figuring out how to have their children taken care of so that they can work and have meaningful employment, getting to and from the places that they need to get to provide for their families, or to go to school, or to go to work, or to go to places of worship. Most of their time is spent in all of that. And so the health system that kind of dissociates all these other dimensions of wellness from health really misses an opportunity to meet people where they are.
New choices, new players, new models of care. You know, consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered health. We highlight innovators who are bridging the gap between sick care and well care, influencing change in the industry, and empowering consumers with cool new ways to engage in their health and wellness. We're also having some fun along the way. I'm Jared Johnson, and this is episode 455. Today, we have the Flava of the Week about how states can apply for their share of CMS's $50 billion digital health transformation program. What are the funds for, and why is this being considered a major turning point for 60 million Americans? I'll talk about that. Then we welcome Dr. O, president of the Advocate Health National Center for Clinical and Community Impact, who earlier this year was named president of The Beacon, a new health and wellness center from Advocate Health being built in Milwaukee. Dr. O will inspire you with her vision for bringing clinical care together with other services that aren't always included in the equation to address physical, mental, and social wellness. It's time for the awesomeness. You're going to love this one. Are you ready? Let's go.
Flava of the Week.
CMS just dropped some major news that looks like it will mark a turning point for rural healthcare in America for years to come. On September 15th, they announced that the funding application period is officially open for the $50 billion Rural Health Transformation Program, the largest investment ever made in rural healthcare, designed to modernize health IT infrastructure, accelerate interoperability, and bring digital health to the front lines of care delivery. The program enables states to reimagine care delivery and develop innovative, enduring, state-driven solutions to tackle the root causes of poor health outcomes specific to rural America. It has 5 strategic goals. Make rural America healthy again by supporting rural health innovations and new access points to promote preventative health and address root causes of diseases. Sustainable access by helping rural providers become long-term access points for care by improving efficiency and sustainability. Workforce development by attracting and retaining a highly skilled healthcare workforce by strengthening recruitment and retention of healthcare providers in rural communities. Innovative care by sparking the growth of innovative care models to improve health outcomes, coordinate care, and promote flexible care arrangements. And tech innovation, fostering the use of innovative technologies that promote efficient care delivery, data security, and access to digital health tools by rural facilities, providers, and patients. Half of the funds for the Digital Health Transformation Program will be evenly distributed to all states with an approved application. Then the other half will be awarded to approved states based on individual state metrics and applications that reflect the greatest potential for and scale of impact on the health of rural communities. The deadline for states to apply is November 5th, and CMS will announce awardees by December 31st. What's the consumer lens here? This is a big deal, y'all. It's fair to say that it could build a digital backbone for the future of rural America, which can't be overstated for the 60 million Americans who live in rural communities. Too often they're left behind in the digital transformation wave. But by directing significant resources their way, CMS is signaling that digital health equity is a mandate now. So for consumers, this program represents new possibilities for addressing technology and access gaps that have long been thought unaddressable. Imagine fewer barriers to accessing your records, a smoother handoff between your specialists and your primary care doc, and digital tools that are designed around you instead of the other way around. If this can be done right, and that is a big if, this will help level the playing field so that no matter where you live, you'll have access to care that feels modern, coordinated, and more human. So what happens next? Right now, states are asking for stakeholder feedback on how to use Rural Health Transformation Program dollars. partners. Who counts as a stakeholder in this case? Health plans and payers, hospitals and clinics, community health organizations and local governments, and tribal leaders, schools, and other community partners. You, everyone who's listening, you play a vital role in helping these stakeholders understand how to shape these dollars before programs are finalized. The opportunity's there, and finally the dollars are there. So now it's on all of us to make sure the outcomes are there too. Let's all keep the pressure on, whether you're a health system leader, a vendor, or an advocate, to make sure this massive investment doesn't get bogged down in red tape or watered down execution. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week. Hey y'all, I'm here with Sina Arham, founder of Friday's Health. Sina, what do you think is broken in the traditional approach to metabolic health, and what are you doing to flip the script?
Let's be honest, the moment in metabolic health is being driven by the GLP-1 receptor agonist class of medications, right? We finally have something that is addressing metabolic health, obesity, and type 2 diabetes in an elegant fashion, right? It's efficacious, it's manageable for patients. And so I think we're having our moment in metabolic health in that the old guard of tackling metabolic health and obesity has a lot of stigma attached to it, a lot of shame and blame and guilt.
Thanks, Sina. Visit joinfridays.com for more information and tell them you heard about it from the Healthcare Wrap.
Healthcare Wrap is sponsored by Cyril. Whether you're trying to drive patient volume as a healthcare provider, boost membership enrollment as a health insurer, drive improved adherence rates in pharma, or deepen strategic B2B partnerships throughout the healthcare ecosystem, Cyril can help you with your go-to market efforts and growth targets, enabling you to reach the clinical and financial goals of your healthcare organization. For more information, go to Cyril.com. That's CYRALL.com.
The flow.
All right, everyone, let's get into the flow. I'm super excited here. I'm here with Dr. O. She is president of the Advocate Health Center for Clinical and Community Impact. And earlier this year, she was named president of the Beacon. If you haven't heard about it, it's a new $50 million health and wellness center that's being built in Milwaukee. And so I have a lot of questions. When we saw the announcement, I was really excited to see this coming about. And I think it's going to be really cool to hear the story about it. But let's start. Dr. O, welcome to the Wrap.
Thank you so much. Thank you for having me. And thank you for your enthusiasm about the Beacon.
For sure. Yeah. As we were just mentioning, leading up right before we hit record, there are just a lot of reasons to be excited about this announcement. And I know our listeners are going to enjoy just hearing a lot about the background, but I'd love to give you a chance to introduce yourself first. If you want to share anything about who you are and what you do and what you're passionate about here. And then we'll get going we'll love to hear the story about what's going on there in Milwaukee.
My name is Dr. Nwando Olayiwola, affectionately known as Dr. O, which was a nickname that was given to me by my patients many years ago in New York City, and it has stuck with me over my career. I'm a family physician and primary care doc by training, but have spent a number of years in various roles in executive and clinical leadership in lots of different parts of healthcare, in the community health space, in the managed care space in the private sector, as well as academic medicine, technology, and health system and care delivery. And so I have committed my career to really making sure that I am focused on strengthening the health of communities, empowering people to be as healthy as possible. That's been manifest in lots of different roles that I've had, and also kind of my previous and ongoing clinical practice, which has always been in safety net settings. So something like the Beacon, as we'll get into, is very much fits with the things that have been part of my career so far.
I'd love to hear what has led up to the announcement of the Beacon. So it's described online, the facility, as a hub for physical, mental, and social wellness. So locally there in Milwaukee. What led up to that? What inspired its creation? And why is this going to be a big deal?
Well, I think before I get to what is the Beacon and what it's going to do, I think it's important to go back into why did we come here and why this? So you may or may not know that the Beacon is going to be located in the near west side of Milwaukee. In that particular part of Milwaukee, it used to be a place full of wealth and lots of economic power and investment in that particular part of Milwaukee for many years. Over time, and due to lots of different reasons, but economic disinvestment, historical trauma in the area, the community has transformed significantly, and it has a tremendous amount of resilience and will to get back to where it was and kind of, if you will, those glory days. But it has seen a lot of disinvestment, companies leaving, folks leaving, challenges with many of the different economic, social, and health indicators that you can think of. So housing challenges, lack of stable, healthy food sources in the community, disinvestment in schools and other resources in the area. And so I think that's a really important piece of why here and why in this particular location. And despite that challenge that I'm describing that has faced this, we've had Advocate Health, and particularly Aurora Healthcare, has had the Aurora Sinai Hospital, is the only standing safety net hospital that still remains in Milwaukee. It's been there for over 150 years. It's not that far from where we're locating this incredible wellness hub. But leveraging the fact that we've got this legacy that's deeply entrenched in this community and a community that is so excited for, ready for transformation, change, and a different future, you bring those together and you have an enormous opportunity. And so we have envisioned this as being something that would respond to what the community needs. And I like the approach that we've taken with this, where it's been, rather than us as a big health system coming in and saying, hey, near west side of Milwaukee, seems like you need some things, and we're going to tell you what those things are. And then you're going to put these things in your neighborhood and in this facility. We've been really intentional, making sure that the community is helping to design this with us. Yes, we have some thoughts on what might be helpful based on what we know from population level data and other analytics and things like that we have. But what the community really needs is what we're after. And that's what we're trying to be responsive to as we create this hub.
Hey y'all, I'm here with Jessica Holton, co-founder of Ours Privacy. Jessica, how do health systems know how much marketing data to track?
Know what you're optimizing for. We see and hear about a lot of teams that are tracking everything they possibly can, which you would think is more info is better, and we can make more decisions if we have more information. But actually, it just sends more data that is potentially PHI, and you have less control over it when you're tracking everything. Instead, choose 1 to 2 key metrics that you are tracking and focus on those metrics.
Thanks, Jessica. Visit oursprivacy.com for more information and tell them you heard about it on the Healthcare Wrap. Yeah, let's focus in on that for a moment. The co-creation aspect of this, I'm fascinated by that because it really could be easy, like you said, to come in and say, yeah, as a health system, we know what you need. Tell us what that was like and why that's so important with this project.
As I mentioned, a lot of my career has been doing work in building, sustaining healthy communities. And one of the things I've learned over the years, both in the United States and in my work that I've done a lot of work internationally as well, is that you cannot do something really successfully in a community if you are just dropping it on them or forcing it on them. The real successes that I've seen have been when an organization can say, we're going to lock arms with this community. We might think we've got ideas, but we want to hear from you. And not just like, okay, we did a survey or we looked at a couple things and we heard some things, but really meaningfully listen. And so we've done that. I mean, over the course of the last couple of years, we have done a lot of listening where we have been able to, we've got hundreds of neighbors in the area surrounding this building. We've got lots of community-based organizations. We've done countless listening sessions where we've sat down and said, tell us what you need, what challenges might we expect, what are the things that you don't have that you think that this could help create, and hearing what people think. And the individuals that have come, the community-based organizations that have been part of these, the families that have been part of these conversations. What's coming out of those conversations is something really interesting. I mean, we have felt for the most part that we can always help support with clinical services. As I mentioned, we've got Aurora Sinai not too far away. So we've got clinical services that are pretty close to where this is going to be. But the things that people have asked for are some of the things that, again, the typical health system, if you're just going in and offering what they might need, you might not come up with them. So the things that people have said as they have been doing these listening sessions, we've been hearing from lots of neighbors, lots of organizations, lots of families, lots of individuals, are things like, we need a safe space that allows for multi-generational programming. So a grandmother can use this space, as can her grandkid and her daughter, right? Like that multiple generations can find some sort of opportunity in this space. We've heard things like, please use this space to help figure out how to increase access to healthy food, to dental services, to legal support, to navigate in a very complex environment. We don't necessarily need more clinical services because we've got those nearby, but we need help navigating this complex web ecosystem that is healthcare. So those are kind of things that we're responding to as we're kind of engineering our view on what the beacon is going to be. Is these are the things that people are saying that we need: access to healthcare, understanding how to navigate healthcare, access to healthy food, access to dental services, support with legal services, how to just know what to do when I have challenges, both physically, but also mentally, and additionally in the social aspect. So we're doing that. So that's been a really important part of this effort, is that deep listening, that deep understanding, coming back to the community and saying, okay, this is what we heard. Check us on this. Tell us if what we think we heard is what you said, and then continue to build out our goals and our objectives based on that community co-creation.
This whole approach is just fascinating to me, because when I hear even a term like a health and wellness facility, right? The word wellness, this is a remarkable aspect of wellness, of what you're describing. Like you said, yes, there are clinical services available, but the answers that people are looking for to be able to navigate their journey here, having access to healthy food, legal services, that's all wellness. We don't always hear enough about that.
You're absolutely right. I remember a few years ago when we started talking about health systems and academic medical centers and physicians' offices starting to take some ownership and accountability around these other things that make people healthy. And we all know in this world that it's really only, when you think about the totality of someone's health, only about 20% of it, in some cases 10 to 20% of it, depending on the person, of their life and their health is influenced by actual clinical, medical, hospital care or interactions. Most of their health, 80 to 90% of it, is determined by their social, environmental, behavioral influences, and those things that really have an impact on their health. And so if we want a community to be healthy, we cannot think that health will come from building another hospital or adding more clinics to the area, because most of people's lives are not spent in those spaces. They're spent getting food for their families, figuring out how to have their children taken care of so that they can work and have meaningful employment, getting to and from the places that they need to get to provide for their families, or to go to school, or to go to work, or to go to places of worship. Most of their time is spent in all of that. And so the health system that kind of dissociates all these other dimensions of wellness from health really misses an opportunity to meet people where they are. And so that's why we focused on this, and also why we actually chose the name The Beacon. I don't think I've shared that with you, but we actually were very intentional about the name, right? For a long time, we knew it was going to be the site in the near west side of Milwaukee, but we didn't have a name for it. And we again used a lot of what we heard from the community, what we heard from leaders in the community, what we heard from neighbors and residents, our staff, our teammates that even live in the area. And we ultimately chose the beacon because we felt like the beacon is a symbol of a guiding light. And Milwaukee has a very deep, rich history with lighthouses and beacons that were really important landmarks given its location and where it is, and that help people find their way and navigate their way safely. So when we decided to call it the beacon, it really was a reflection of that hearing from folks, and then reflecting our mission to really be that guiding light, source of support, offering guidance, but again, doing that in partnership with community.
No doubt it will be a guiding light in this way. And kind of coming back to how to address an opportunity, whether for a health system or other healthcare entities out there, not just coming from building another hospital, it's coming from understanding these needs. You're describing these very clear needs that we as individuals, as consumers, have with our health and wellness. And you're right, they're not all addressed with clinical services. So there's a healthy understanding there that needs to happen, and there's leadership that needs to happen. And there are facilities that we need to understand that not everything happens virtually either. So we still need in person-to-person interactions as part of this journey. And these are all pieces that are very clearly being considered as the beacons being built here. So I just love the thought of that. And are there other aspects of it that are just worth noting at this point? I know a lot's to come, and I know a lot's going to be here in the future, but are there other aspects of this story that we want to make sure are being told even at this point?
One thing I would also just want to point out is that we have a really incredibly brilliant consumer insights team that does a lot of work in understanding what our communities are saying, what folks need. We have a team that does what's called community-based participatory research. They do a lot of work in understanding community voice and leveraging that into insights. And one of the things that has been really fascinating as our consumer insights team has been doing some understanding around wellness is that if you ask 10 people to tell you what wellness means, you will probably get 20 answers, right? Because wellness is so nuanced. And you could argue that, as I mentioned, I still do patient care. And recently I was in my clinical setting and I had a family that I was taking care of. The mom in particular was applauding her on some progress that she's made in some of her physical conditions, one of her chronic diseases. But she was reporting that she was not feeling good because her daughter is struggling with mental health issues. And in her mind, if you took a purely like medical way of looking at wellness, you would say she is well, right? She's had this challenge with her diabetes. She's making incredible progress. Her numbers are looking good. Her sugars, blood glucose is looking good. So she's well. But in her mind, she's not well because her daughter's not well, right? And so I just think we have to push ourselves out of the traditional notion of what wellness is because it means different things to different people. And if you can create space, again, we keep hearing about the opportunity for us to create space with the Beacon. If you can create space for people to be able to articulate, what does wellness mean to me? What does it mean for my family? What does it mean for my community? What does it mean for my zip code? And you leverage the strength of the health system in helping to solve for some of those gaps that exist when you hear that. I feel like you do a great service to the community and you respond very intentionally to what people are really asking you. And that's what we're trying to do.
I love every aspect of it, which leads me to kind of my final question here. If you had a platform, you could just share a message with those who are struggling to access the care they need. They're struggling to navigate this journey for them, for their families, family members, for their community. What would you tell them?
Advocate Health is really committed to this mission of for all, making sure that healthcare is accessible, that healthcare is, the definition of traditional healthcare as we know it is broadened beyond just the delivery of medical services, in many cases in response to an acute or chronic situation. We really fundamentally believe that your health and your wellness is complex and it's got a lot of dimensions to it. And a health system partner like our Advocate Health, which is the organization which Aurora Healthcare sits under, we want to know all of that because we believe that we can give you the best care if we understand all the dimensions of health that are at play in your life. But if we also leverage our really good services in healthcare with these other opportunities in the community, we think that's a winning combination for people, for real people and real lives and real families. And so I would say just see us as a place that is not just about your physical health, but about all the other things that enable you to have good physical health, that enable you to live freely and achieve your full potential from a health perspective. That's who we are, and that's how we roll.
Dr. O, thanks for opening our minds and helping us understand what wellness really means here, and best of luck with everything you have going on here. Can't wait to see what comes next.
Thank you so much, and can't wait to have you see the Beacon when it's all done.
We would love that. Thanks so much.
All right, take care.